Hi, welcome to Oral Pathology. My name is Karla Toledo. I am a registered dental hygienist, and today I will be performing a head and neck oral cancer screening. Patients will come to see the dentist more regularly than they see their medical doctor. As dental hygienists, we work alongside with dentists to find any abnormalities in the patient's head and neck region as well as the oral cavity. Things to look for in the head and neck would be any lymph nodes that are inflamed, swollen glands, also in the face area, skin discoloration, or anything that the patient is noticing is changing in color or growing. It is very important to document. Not only is it essential for us to be performing the head and neck cancer screening, the most important thing is for us to educate our patients and to teach them how to perform a self-oral cancer screening. So I will be demonstrating that today. To begin the oral self-examinations, you want to start by washing your hands. You should perform an oral cancer self-examination on a monthly basis. You can do so after brushing and flossing your teeth. The materials that you will need in order to perform this examination will be a gauze, a well-lit room, or a flashlight, and you may do so in front of a mirror as well. What you want to do is start with checking visually your scalp, your head and neck region, checking for any abnormalities that you may see. Start with an inspection of your scalp area as well as your face, your temples, cheeks, head and neck region. Using 2 fingers, you want to go bilateral and digitally, so starting with your temples. You also want to feel in front of your ear, behind your ear, and you're feeling for any pain, any tenderness, any lumps or bumps out of the normal. Now you want to go to your lower jaw and do the same, inspecting the submandibular lymph nodes. We will continue this motion, head and neck region, examining the anterior and posterior cervical nodes. Inspect the thyroid of any obstruction or any swollen lymph nodes. For the intraoral examination, start with a visual inspection of the vermilion border of the lip, rolling them between your index finger and your thumb. Check for any irregularities. Inspect your upper and lower lip and your gums. Pull your cheek away to check for any texture, any red or white patches around the cheek area. With a gauze, pull out your tongue and check the sides for any red or white lesions. Repeat on the other side, checking for any ulcers or changes in texture. Another important location is checking underneath the tongue. With your index finger in the palm of your hand, create pressure and palpate the submandibular salivary gland. And finally, inspect the back of your throat. The reason I chose this topic of oral cancer assessment is because I have found 4 cases of cancer during my clinical career as a registered dental hygienist. I have been practicing for 6 years, and a lot of the cancers have been on the head and neck region. I have found thyroid cancer, as well as oral cancer, including a cancer in the prostate, but the patient had lymph nodes on the upper head and neck region as well. So that is why I take it very seriously, and I'm passionate about teaching oral cancer screening, not only performing them, but also showing them to my patients, the importance of examining themselves on a monthly basis. While they're brushing their teeth, they can do it. It takes a couple of minutes and it can save somebody's life. I found thyroid cancer on my stepmom. We were out for dinner and I noticed that while she swallowed, she had asymmetrical lymph node on the right side. I told her if I could feel it and she allowed me. I was able to palpate around it. It was hard, it was unmovable. It almost was the size of a nickel, I would say. I would describe it. I told her to go see her medical doctor. She did, and then they ended up finding out that it was an aggressive form of thyroid cancer. Not only did she have her thyroid removed, she also had lymph nodes in a muscle. So that is the reason why I take it very seriously, checking for oral cancer. So I hope that this video was helpful to you guys. and that you are able to incorporate it in your clinical practice and teach it to your patients. Have a great one. Thank you.